Hi, Dr. Hadian again. Continuation of our discussion about the object relations. Related issues with eating disorder and anorexia. Basically, the matter with eating disorder that usually is caused due to the trauma suffered at the ages between 3 to 5 with the anal phase. Anal phase mostly is a phase of developmental growth in the emotional and psychological developmental of the child, that issues with control and ability to stay on the course of one's needs and decisions are being established. Now, if there is a trauma at this stage of development, basically between ages of 3 to 5, there are a lot of related issues with control and anality, if you want to talk basically as a kind of like day-to-day discussion of the issue, as they call it, and they say, you know, I'm an anal person, which means positive related issues with obsessive compulsive disorder, obsessive personality structure, and withholding and controlling attitude, which ultimately in relationship with food, which goes back to the object relationship. With the relationship with the food, the human being begins to become controlling, conservative, withholding, and that could exhibit itself with anorexia. And then a lot of anorexia nervosa symptomatology, which is exhibited especially in adolescent and young adulthood, are related to chronic experiences of stress related at the developmental ages of 3 to 5. And therefore, besides the point with understanding the genetic precondition, the issues related to biological preconditions and biological sensitivity of the human being, we can see this related manifestation of anorexia nervosa with regard to a controlling, withholding relatedness with object of choice, which is food, which again could represent mother, father, siblings, and environment. Now, the treatment of all of these basically has to be a multi-focal point with regard to biological treatment, medication treatment, psychotherapeutic intervention. And when I say psychotherapeutic intervention, it's not just a mumbo-jumbo sitting and talking to the wall and not getting any response. It's basically the psychotherapeutic response in this kind of object relationship in a person who's very withholding, anal, very hard to penetrate emotionally and to have a relationship with, and has very much passive, aggressive, controlling attitude in her or his relationship with the world, is to build up a positive, trusting, uncontrolling, accepting, understanding relationship. And this psychotherapeutic relationship then could begin to change those previous experiences that the child, the adolescent has had with their significant others, quote unquote parents, and the environment that the person is being brought up. And then by the changes that happen in this relationship, there's going to be a different perspective in the relationship of the child, adult, adolescent, and the inner child, and the person who's sitting in the therapeutic environment, in therapy, with the doctor, with the psychiatrist, and therefore changing this attitude would begin the change of the attitude of relatedness to the object of food. So then the change of the relationship between the people, the person, could have an effect in the change of the relationship of the patient with food. Besides the fact that medication, antidepressant medication, has been very, very helpful, recently with serotonergic reuptake inhibitors, has been very important to take care of the biological problems related to anorexia nervosa, because there's a lot of interrelated issues with biological depressed condition and major depressive disorder with the anorexic phase, which I will discuss that later. And any questions, you can relate that and email it to me or call me at my number. Thank you.